The background to our project really is Harlem and pediatric AIDS. Pediatric AIDS until recently was a leading killer of children in Harlem, now almost eradicated. But the way we got interested in the Dominican Republic was we responded to a plea from a group of nuns who was hoping to be able to treat a pregnant woman who was infected with HIV. And the woman wanted to have a baby who was not infected with the AIDS virus. And so we were called to see if we could help. Now this was at a time when there were no AIDS drugs at all in the Dominican Republic. We ended up introducing the first treatment for pregnant women with HIV back in 1999 and succeeded in lowering the transmission of the AIDS virus from about 40% if you don't treat to about 1% if you do treat, comparable to here in New York. And then in 2004, when AIDS drug prices came down, we started one of the first family AIDS programs in the Dominican Republic. The way I got introduced to global health was really as an outgrowth of work that we were doing in Harlem with children with AIDS. AIDS was until recently the leading killer of children in Harlem, now almost eliminated. But serendipitously, we got a call from a group of nuns down in the Dominican Republic who had in their care a pregnant woman with HIV, and they wanted this woman to receive treatment so that she would have a baby who was born AIDS-free. At the time, there were no AIDS treatments at all in the Dominican Republic, so we were asked to get involved. We ended up introducing the first treatment for pregnant women back in 1999, and in the province where we're working in La Romana, have brought the mother-baby HIV transmission rate down from between 25 and 40% if you don't treat, down to under 2%, which is comparable to New York City. The second thing we then did as AIDS drug prices came down, is we started the first family AIDS program back in 2004. So those are the primary components of our program. And we discovered along the way that these are wonderful programs in which to get residents involved during their education and training. I think there's several values for residents doing rotations in the Dominican Republic. Many applicants who come looking at us as a program, as a residency training program, are very eager to have global health experiences, and many of them also want ways to improve their cultural skills with Hispanics or Latinos, and ways to improve their Spanish-speaking skills. So all of those things are things that they'll have experience with if they go to the Dominican Republic. I think also because we sit in Washington Heights, which is a neighborhood which is predominantly Dominican, we take care of a lot of Dominican immigrants, we take care of a lot of Spanish-speaking patients, we take care of a lot of poor. I think that there are two things that residents get when they do go down to do a rotation. One is that they come back with skills learned there that have got to do with improved language, deepened sensitivity, certainly improved medical skills, and I think a heightened awareness of what patients who have come from the Dominican Republic have experienced. And so they come back here to Washington Heights, and I think they get more engaged with the patients that they see. And I think that not only makes them better doctors, but the important thing is it provides better medical care for the patients that are in our hospital's care. I think sometimes it's not entirely obvious what the rewards are of having experience in global health. And I think, without doubt, the largest single reward, I think, from being involved in global health is the satisfaction that comes from helping others. In our particular experience, we've been able to save literally hundreds of babies from becoming HIV infected. We've got a clinic that we're running now that has got several thousand patients, of whom about 1,500 are on AIDS drugs, and many of our patients certainly would have died if we hadn't had that treatment. So direct patient benefits are extremely satisfying. I think the other thing is being involved in a process that leads to sustained improvement of the healthcare system. Something that we certainly didn't think about when we got involved was that the possibility that we may actually improve the overall health care in the Dominican Republic. The regimen that we introduced now almost 12 years ago is now the standard of care throughout the Dominican Republic for pregnant women. So that's been highly satisfying. I think a third aspect, which doesn't sound like a reward, but I really think it is the absolute frustration that you grapple with when you walk into a resource-poor setting, when you're outside of the sort of technological comfort zone that we grow up with. You don't have the resources that we're used to. You're oftentimes surrounded by woefully inadequate medical systems, and yet it's by dealing with those systems that you find part of your perhaps inner self that makes you a better doctor. I think these are qualities that are not always perhaps grown quite so well here in the United States. So I think those are special experiences. I think global health is a little bit like a huge Rubik's Cube, and the solutions are sometimes rare, hard to find, but I think through a combination of patience, ingenuity, and persistence that you're able to really find satisfactions you don't expect.